Welcome back to Autism Live. It's Friday, Research Friday, so we're welcoming the fabulous Dr. Jonathan Tarbox to the studio. It's so great to have you back again.
Always good to be back.
I canceled on you last week. I apologize for that. Right. But we have you here today. It's been a while because we were at the conference, and so wonderful to have you back. If you haven't watched the show before when Dr. Tarbox has been on, he is the head of research and development here at the Center for Autism and Related Disorders, and he's a wonderful resource. If you have a question, now's a really good time. If you're watching us live, you can just type it into the question box and send it over to us. If you're watching and we're not live, you can email, you can Facebook, you can Twitter, you can tweet away, whatever it is that you want to do. Because even if you're watching a rebroadcast, we have Dr. Tarbox come in every Friday, and we know where he works, so we can find him.
And it is part of our mission here at CARD is to get information out there to parents, research-based information on what works, what doesn't work, and other resources, as well as Autism Research Group, our nonprofit, of which I'm the executive director. That's one of our major missions, is get information on scientifically proven treatment out there. So yeah, if people have questions about what works, what doesn't work, or just want research information on anything related to autism, they should email us, and we can see what we can do to help.
Okay, and I have to say, he's not just saying that. Anytime I've come to you and said, okay, we have a parent with a question, you are just, so willing, and you get excited, actually. Quite the opposite of what you would expect, but he gets excited, says, oh, that's a great question, and you're always interested in helping. And
well, it's literally part of my job, and I like it, so
there
great.
You go. Wonderful. And we were just talking about the myth of the day, talking about autism versus autisms, and the whole idea of phenotyping autism, and I said, we actually do have somebody who knows what they're talking about, because I don't completely get it. I don't pretend to completely get it, but I get it around the edges, and I know how important it is. So maybe you can explain so that I actually do get it. What is phenotyping autism?
Sure. So the general idea behind phenotypes is that there are different subgroups. So phenotype basically just means a subclass or subgroup within an overall group. So the idea is there are different subgroups within overall autism spectrum disorders. We already know there's autism, PDD, NOS, and Asperger's, although the distinction between those isn't entirely clear. There's a lot of gray area, as we all know, between those. But we also all acknowledge that, the old saying, when you've met one kid with autism, you've met one kid with autism, right? So within the overall autism spectrum disorders, there's a huge amount of variability. But there does appear to be some sort of clusters or some sort of subgroups within all of the variability. Very few of these have actually been proven by research yet, or really well described by research, but there's a number of research groups in a number of different areas trying to do this. The basic rationale is, why would we want to know, right, what the different subgroups are? The basic rationale is there's probably something different going on with these different subgroups. So I can just sort of talk about some off the top of my head. A major distinction that we look at in early intensive behavioral intervention is in response to treatment. And so there does seem to be some kind of difference between children who respond particularly well and rapidly to ABA intervention versus those who are more moderate learners. And so everyone responds. There are no zero responders. That would be equivalent to saying an organism can't learn, which is ridiculous. But there is a difference in rate of response, and so we're very interested in what that difference is. Not just so that we can give treatment only to the high responders, but quite the opposite, actually, so that we can figure out how to adjust our treatment to make it more effective for the kids who respond more slowly.
Right, which is amazing.
Yeah, well, it's a big task to undertake. We haven't made much progress on it yet, but we're working on it.
But I think as a parent, especially in the early days, whenever I would hear somebody talking about their child with autism, and they would describe, how they discovered their child had autism, and I was always hanging on the end of my seat saying, and it was very quick, I could say, oh, that's not my child, or, oh, that's my child. And if it was my child, I was always particularly interested to hear what had they done.
Right, absolutely.
And so what worked, and over and over again, of course, what I heard was ABA, ABA, and of course, for all of our kids, like you said, there's going to be progress, but it just made me that much more interested in getting started with ABA.
Well, of course, that's every parent's first thing that they think of is, okay, who else has a situation like mine? Whose children are similar to mine? And of course, every child's different, but another big difference that we see, or another big hunch we have, is kids for whom sort of visual stimuli are really important, and or auditory stimuli maybe are really challenging. And so a term that's thrown around sometimes is visual learners, and I don't really know the scientific basis for that term, but I have made a clinical observation, and a lot of folks folks have, that there does seem to be a difference between kids who just respond incredibly well to treatment when you really embed lots of visual supports into treatment versus other kids who really don't need that, and that's maybe just not a very salient source of stimulation for them in their environment. Children who are hyperlexic, who respond incredibly well to letters and words. You know, we've seen children with autism who are pretty severely impaired in language in general, and yet can teach themselves to read, which is very strange.
It's interesting,
right? It's interesting. And so what's the difference? What's going on there? Is it just a difference in behavioral repertoire? Is there something else going on? But more importantly, what can we do about that to make treatment more effective and to support these folks better?
We just the other day showed a TED Talk with Temple Grandin, and she likes to separate things into those categories too. She says visual learners and more conceptual learners, and it was through one of her talks that I realized, because I'm a visual person, but my son is more conceptual. And that sometimes when I was trying to convey something to him, I would frustrate him to the point of...
Because you're doing it more visually and he doesn't get that, or it's not getting through?
And so I would explain things, and even yesterday I was giving somebody directions to get someplace, and I don't look at the street signs. I go, well, you want to go down to that red store and take a left, and they would go, what kind of directions are these? And that's how I would try to teach my son, and he needed the whole concept first. So I have to remind myself when I teach him something new, here's the whole thing, and then I can take it apart into smaller visual things, and then he can handle the way I talk.
Got it. Yeah.
And so he can communicate. He and I can communicate. But that had not occurred to me before she said that. I just thought everybody was visual.
Well, and it's interesting too, because some ABA folks don't like the whole visual versus auditory versus conceptual distinction, because they think it's kind of creating sort of a made-up explanation for why maybe your treatment is or isn't working that isn't very useful. But it actually is analyzable in ABA terms, because all it's doing is pointing to different aspects of the environment that tend to be particularly important for that individual.
And
so it's
maybe
not
reinforcing.
That's exactly right. Yeah. So more reinforcing. B, just the individual attends to those types of stimuli more. They're more interested in them. They're more salient. So it actually fits very well with an ABA perspective, because all it does is point towards which aspects of the environment you can harness to make the kid learn more effectively.
Yeah.
And no one's saying that a visual learner can't learn auditorily or vice versa.
Right.
That's ridiculous.
Right.
But it may well be that learning occurs a little bit more easily in one modality versus another.
Which would be a really beneficial thing to know as a parent, as a teacher. Incredible. Okay.